Healthy population, healthy mothers, saving the future generation. This lady is called Ruth, though not her real name to protect her identity. She is 28 years old. She was born in Opotan village, Rhino Camp, Arua district. She has lived with fistula for 18 years after attempting to deliver her firstborn through traditional birth in 1998.
Take me to the hospital, so they refuse. That's why they caused me that problem, because they deliver me at home.
Before reaching the nearest health center, she walked but couldn't cover the 30 kilometers. Accompanied by a neighbor, they sought services of a traditional birth attendant as labor pains increased. Unfortunately, it was too late.
The people who are at home will just put their hands on your private parts, when that they just want to remove that baby.
The overdue labor had affected both her and her unborn baby in many ways we can only imagine. She had developed obstetric fistula, and the newborn baby died. Obstetric fistula is described as a serious injury during childbearing, brought about by an outlet in the birth canal caused by prolonged, obstructed labor due to lack of timely and inadequate medical care. Frustrated Ruth returned home after failing to get adequate treatment. Unable to fend for herself after her loss, depression took its course.
Fistula is a condition in which a lady following a very difficult labor and delivery, she suffers from a hole in her vagina, between the bladder and vagina, leaking urine all the time, and between the bladder and a rectum, which should be leaking stool. Not every case gets the double fistula, but the commonest one is urine.
The odor from her body frightened everyone around her, and she often felt abandoned. The last blow that drove her into depression was when her husband divorced her. She feels humiliated and desolate, often thinking that her state is a curse. Ruth says that her dreams are shattered after her husband remarried.
He just even refused me because of this sickness, so she decided to marry another wife. For him, so I'm now useless. Yeah.
Besides this tragedy, there is lack of access to healthcare services in hard-to-reach areas. Some mothers fail to report such cases because of ignorance, save the hostile health workers, discrimination, and stigma in society. For Ruth, from northern Uganda, society has rejected her. As if that's not enough, she continues to live on her own and will never produce another child.
But because of this sickness, you cannot stay in a community, you cannot stay with your husband can hate. No one can going to marry me again.
Most fistula patients in Uganda, like those in other countries, are young and poor with little education and limited access to quality health care, including emergency obstetric care.
And when the delivery is not conducted well, there are times there are mothers who have big babies, or there are mothers who have maybe obstructed labor. Now when you go to a TBA cannot tell you that this is obstructed labor, it needed the hospital help. They'll say try. In the process of trying, you find these mothers get their bladders torn during delivery.
A baseline assessment of obstetric fistula in Uganda indicates that patients lack the knowledge that the condition can be repaired and are too ashamed of their condition to seek help. Those who remain untreated are shunned by their communities and relatives and must find new ways to support themselves. Women and girls with obstetric fistula are constantly wet. They release an odor that scares away even their own relatives.
Majority of these mothers are abandoned because, when you are leaking urine, you are ever smelling. And there are some husbands who do not want to also have that bad smell. So in the process, they divorce you and they feel this is a condition which cannot be helped. Why should I stay with such a woman?
Affected young girls or women tend to live in fear stigmatization, silence and isolation. The survey further indicates that the women getting recurring infections suffer infertility and damage to their vaginal tissue that makes sexual activity difficult. They also have paralysis on the muscles in the lower limbs. This is partly why divorce is common among such categories of people. 42-year-old Zachary Owiko from Moyo district, whose wife is battling fistula, believes in a for better or worse.
Yeah, that other men, other friends of his are advising him now to marry somebody. But he said he cannot leave her in this condition. If he marries another wife, this one feels that he has divorced her. Then it will bring a problem to her. Yeah, so I'm telling men out there, they are equally responsible for this condition because their wives get this condition mostly during delivery. So they should not abandon these women. They should be together. They should support them.
Gustavan Waswa, husband to Harriet Kamia from Makerere district, kept secret to himself.
Kyempabula abala abasajja ng'abo abakyala baba bafunye obuzibu ng'obwo babe nga basobola okugumiikiriza kubanga amalwaliro gye gali agasobola okuwonya ekirwadde ng'ekyo bagumiikiriza okutuusa mukyala bwe basobola okuba nti awona.
Government wants health workers to mobilize women into an awareness campaign and encourage family planning to nurture a better population.
So if we end teenage pregnancy, if we end these early marriages, we shall be able to end fistula in this country.
In 2012, Uganda Demographic and Health Survey estimated between 140,000 to 200,000 women living with fistula in Uganda, with 1,900 new cases every year. Most hospitals in Uganda are unable to repair fistula cases due to lack of surgeons trained in the specialized procedures required to properly close them. Secondly, the patients themselves can't afford treatment fees. A fistula repair costs about 300,000 Ugandan shillings, whereas in rural health facilities, 40,000 shillings charge is too high for many people. Most victims then resort to clinics or drug shops for painkillers or traditional medicines. Patients say they bribe medical personnel where treatment is free to get access. Dr. Justus Paragine, the head of the Urogynecology Division at Mulago Referral Hospital, says the treatment at the National Referral Hospital is free of charge.
You found me operating somebody who is 78 years, who has lived with a fistula for 37 years. So she's had a hard life, but recently she bought an FM radio and then she had it on announcements.
Dr. Jacinto Amandur, Commissioner Clinical Services, Ministry of Health, says that though there are various challenges towards treating fistula, the ministry has plans to eliminate the disease among the affected and infected mothers.
One is to prevent new cases occurring, and this can be done through good antenatal care, family planning services, access to skilled birth attendants, and also access to cesarean sections and other interventions.
He says the Ministry of Health has trained a number of fistula surgeons, and all 13 regional referral hospitals in the country are offering free fistula services.
So I'm telling them out there, they should come to the hospital. This is a condition which can be helped by doctors. They can be operated and they get better and they go back to their families when they are happy.
Government spends over 700,000 million shillings annually to treat fistula. In line with Ministry of Health fistula guidelines, different organizations initiated numerous campaigns to prevent and treat fistula.
There are so many people out there that are suffering from fistula, and we want them to come out and get medication.
Now, fistula is a threat to humanity. So it's not just therefore a health threat, it's also a security threat.
With additional social support and counseling, women are able to successfully reintegrate socially following a fistula repair.
Grab the services, now at least I feel better.
The persistence of the problem reflects wide burdens in society, including gender, social-economic inequality, lack of schooling, child marriage, and early childbearing. Many women still experience fistula thanks to efforts from various organizations in the fight against the disease.